Hi, hello, and welcome. Today we are going to discuss about incision and drainage and examples. What is incision and drainage? I&D is a common surgical procedure used to treat infections such as abscesses, cysts, and boils. The process involves making an incision in the affected area to allow for purulent drainage, thereby relieving pain and pressure and promoting healing. The key to incision and drainage. I&D procedures are classified under CPT codes 10060 to 10180. Each code represents a specific type of I&D procedure, differentiated by the complexity of the procedure, the number of incisions performed, and the type of lesion. Certain key words and phrases in the provider's documentation can help ensure accurate coding. Here are some examples. Abscess indicates the presence of an infection that requires drainage. Incision refers to the surgical cut made to drain the abscess. Drainage, the process of removing the infected fluid. Simple describes a straightforward, uncomplicated procedure. Complicated indicates a procedure involving multiple abscesses or additional surgical effort. Pilonidal cyst, a specific type of abscess located near the tailbone. Hematoma, a collection of blood outside the blood vessels, which may require drainage. Seroma, a pocket of clear serous fluid that sometimes develops in the body after surgery. CDI leads to improved coding. Simple procedures should not be coded as complicated ones and vice versa. Tips: always review the clinical notes carefully to capture all necessary details for accurate coding. Familiarize yourself with the definitions of simple and complicated I&D procedures to differentiate them accurately. Use modifiers 59 when multiple procedures are performed in separate anatomical areas. Keep abreast of any updates or changes to the CPT codes and guidelines to ensure compliance. Incision and drainage step-by-step coding. Step 1, patient assessment and preparation. Assessment: evaluate the abscess. Determine size, location, and severity. Review PMH. Check for any underlying conditions, allergies, and current medications. Consent: explain the procedure, risks, benefits, and aftercare to the patient. Obtain informed consent. Preparation: clean and sterilize the area around the abscess. Administer local anesthesia to numb the area and reduce pain during the procedure. Step 2, incision. Using a sterile scalpel, make a small incision over the most prominent part of the abscess. Ensure the incision is adequate to allow thorough drainage, but small enough to minimize tissue damage. Step 3, drainage. Gently apply pressure around the abscess to expel pus. Use sterile instruments, if necessary, to break up any loculated, pocketed areas of pus. Step 4, irrigation. Flush the abscess cavity with a saline solution to remove any remaining pus and debris. Ensure the cavity is thoroughly cleansed to promote healing and prevent recurrence. Step 5, packing and dressing. Packing. Insert sterile gauze or a drainage device into the abscess cavity to keep it open and allow continuous drainage. This step is crucial for larger abscesses to prevent premature closure of the incision. Dressing. Apply a sterile dressing over the incision site. Ensure the dressing is secure but not too tight, allowing for drainage and air circulation. Step 6, aftercare instructions. Wound care. Instruct the patient how to care for the wound at home, including changing dressings and keeping the area clean and dry. Advise on signs of infection or complications to watch for, such as increased redness, swelling, or discharge. Pain management. Recommend appropriate pain relief measures such as over-the-counter pain medication. Follow-up. Schedule follow-up appointments to monitor the healing process, change dressings as needed, and remove any packing material once drainage has ceased and healing has progressed. Medication. Prescribe antibiotics if there is a risk of further infection or if the patient has systemic symptoms. Ensure the patient completes the full course of antibiotics as prescribed. Step 7, monitoring and complications management. Monitoring. Regularly assess the healing process during follow-up visits. Check for signs of complications, such as recurrent abscess formation or secondary infections. Address complications. Manage any complications promptly, which may include additional drainage, changing antibiotics, or other medical interventions. See code list of incision and drainage procedures. Okay, that's all about incision and drainage procedure. Next, we will see some coding examples for incision and drainage procedures. This will help you in your CPC examination.